They were three ordinary people on three common medications, with one terrifying pattern: sudden, uncontrollable sexual urges that destroyed their lives. Now, the most extreme case of this was what happened to Terry Martin. He was a former member of parliament in Tasmania, Australia, and he had developed Parkinson's disease. And one of the drugs he was prescribed was pramipexole, a drug commonly used for Parkinson's and depression. And over a span of about 2 years, Martin spent around $150,000 on over 500 encounters with sex workers. Prior to these medications, he was heterosexual. When he was medicated, his sexual behaviors included men. But it didn't just stop there. Tragically, he eventually committed sexual acts with someone who was underage. Now, after he was arrested and his case reached the Tasmanian Supreme Court, they found a direct causal link between the medication and Martin's behavior, stating that he would not have committed the offenses if he had not been on that drug. He received a conviction, but his sentence was suspended, specifically due to the court's conclusion that his behavior was the result of a medication and not long-standing intent. Next, let's look at the case of ropinirole in Claire. She was given this drug for restless leg syndrome when she was pregnant, and at first it worked well and her symptoms improved. But a year into treatment, she began to experience strange urges, uncharacteristic urges. She started leaving the house in the middle of the night cruising for sex, despite having a partner at home. And sometimes she'd wear see-through clothing and even flash random men. As she wasn't warned about this side effect, she didn't connect the dots for a long time, and it took years for her to find out what had happened. Eventually, after stopping the medication, the urges disappeared immediately, but the shame, the relationship damage, and the emotional fallout was all still there. And what's especially haunting about this experience was her quote when she reflected on what had happened. She said, "It affects you to the point that you don't even know you're doing it." Now, this side effect has been recognized in the label of the drug where it describes sexual urges. And this came out in 2003, where GSK actually knew about the link between this drug and an inappropriate sexual encounter between a man and someone underaged after starting this medication. Now, the last case involves a drug called Abilify, known as aripiprazole. This is widely used for schizophrenia, bipolar, and even depression. And this case involved a 24-year-old man with schizophrenia. He had done well for years on another medication, but after switching to Abilify, his behavior rapidly decreased. He lost his job after he was found touching himself inappropriately at work, and he'd also begun acting in a sexually disinhibited way around women, and this alarmed his family. He was eventually admitted to the psychiatric ward, where he became so interested in sexual activity that staff had to monitor him around the clock. Eventually, the doctors there linked his symptoms to Abilify, and the medication was stopped. Yet it took 3 months for the sexual compulsions to completely disappear. Now, I want to be clear about something because these stories may sound too crazy to be true, but these are real cases pulled from medical journals, investigative journalism, and legal cases. And in each of these cases, the person had never had a history of that kind of behavior before. Now, why does it happen with these three drugs? Well, the link between all of them is that they act on the brain's dopamine circuitry, which drives motivation, pleasure, and reward. And it just seems that in some patients, overstimulation of those areas can lead to this obsessive, uncontrollable sexual behavior. Now, in each of these cases, it was interesting that the doctors didn't catch on to this. Why is that? Well, oftentimes the patients are spellbound and so they don't even realize it's happening. But also doctors really aren't going to ask about those kinds of things because they're considered private. And finally, maybe if some of these behaviors even happen, many doctors will misdiagnose it and say that they're coming from the patient's bipolar disorder or their schizophrenia. So what needs to change? Well, at a minimum, patients need to be informed about these risks, and not just the patients, also their families. When you're on a drug that can change the way you act, oftentimes you don't realize it's happening. So when patients get started on this, a loved one needs to know, and they need to be told that if the behavior of the person taking the medication changes in an unexpected way, they need to stop the medication and come and see the doctor immediately. And if you like learning about the unusual side effects of common medications, you're not going to want to miss this video where I talk about the top 10 most dangerous prescription drugs.